I am Anton Gunn. I'm so excited about being here with all of you. This is going to be a phenomenal day, and it's going to be made phenomenal by each and every one of you. I'm Anton Gunn, and I am here today to kick off this session this morning with a presentation called Like Steel in the Hour of Chaos. But before I get started, I want to make sure that we're taking advantage of the chat function. And you know that I want this session to be interactive. I want you to be engaged, and I want you to help me to make this a great day. So if you could start by telling me the city and the county that you're logged in from. I know we're all virtually, we can't be together, but this is a telehealth day and a telehealth world, so I know everybody here should know how to use technology. So use the chat function and tell me the city that you're typing in from and the county. I want to know your county as well. So we got Charleston, we got Greenville County, and we got Greenwood, Irmo, that's in Richland County, of course. Charleston is in the house. It's great to see. Where's Lane, South Carolina? I saw somebody put Lane in there. My Columbia peeps are in. It's really good to see. Williamsburg County, good old Williamsburg County. It's great to see them. Berkeley, Allendale, Darlington County, my Darlington County folks, Hartsville, Yogi Bear Chicken, the best chicken in the whole world. Don't tell anybody I told you that, but tell everybody I told you that. It is really good to see all of you, and I'm so proud of the opportunity. My folks in Sherrard are here. It's great to really see the entire state of South Carolina logged in today. And guess what? We got people outside of South Carolina. So we got Bob in Atlanta, Georgia. Now, Bob, are you in Atlanta, in Fulton County, or are you in Cobb County or Marietta or Henry County or somewhere around the Beltway of Atlanta? Doesn't matter where you are here this morning, and I'm excited to share and present with you today. So let's jump right in, and I want you to keep a pen and pad handy. I want you to keep some notes handy. If I say something today that resonates with you, that speaks to where you are or where you want to be, I want you to make sure you write it down. I want to make sure that you share it in a chat so people actually know what is resonating with all of you this morning. So let me jump right in. So I'm going to share my screen. I'm going to put my slides up for each and every one of you. So I'm going to click on slides, and I'm going to click here. And I want you to type into the chat that you can see the words Anton Gunn on your screen. So I want to know if you see the words Anton Gunn. So say, I see the words. Somebody type in, I see the words. Okay, Sylvia, you gave me the details that I needed, and I really appreciate that. So let's jump right in. And I want to take a serious note very quickly, is to talk about chaos and crisis. So 2020 has not been the year that any of us wanted it to be. And we've been thrown into some level of chaos and crisis. And I put the following, phrases underneath the words chaos and crisis, because this really kind of speaks to the challenge and the opportunity that we have before us right now. The COVID-19 pandemic has brought an unprecedented level of chaos and to some degree a crisis of how we manage public health in our state, how we take care of ourselves, take care of our families, take care of people who may be incarcerated or in a nursing home, or people who are just in rural areas. And this COVID pandemic has played itself out in ways that we never thought. And I'm pretty sure that some of you on here are like me, have personal friends and family members, or extended friends and family members who are no longer with us because of the chaos and the crisis brought on by COVID-19. We also know that our persistent lack of broadband access across the state of South Carolina has left many of our rural communities isolated from the care that they desperately need, that they need every day and have always have needed. But now, because of global pandemic, you can't even get a transportation system to take you to a hospital because the hospitals were closed or the outpatient clinics were closed. And so telehealth has become a higher priority, and all of the work that you do, all of the things that you've been working on for many years have become a higher priority. But it's even more of a crisis because you can't get it to some places because they don't have adequate broadband access. In places like Williamsburg County, in places like Edgefield County, towns like Johnson and other places, you don't have the access that you need. And then you couple that with the massive amounts of unemployment, the number of people who've lost jobs around the country and in South Carolina, restaurants closing, retail establishment closing, people closing their doors permanently because they couldn't sustain beyond 2 weeks, much less 2 months, and the currently 8 months that we have been dealing with this global pandemic, largely in the United States. And so a lot of people are losing jobs, which means they're losing their health care. And this chaos and crisis is really affecting our economy. And then you add the last two bullets, the amount of racial injustice that we're now experiencing and living in real time. And what do I mean? We've always had racial injustice, but never before in the previous 50 years have we had the amount of social unrest in the response to the racial injustice. And so this is putting a lot of other things in crisis. The people that we work with every day are not feeling valued, not feeling respected, not feeling included. And we're seeing it play itself out in ways that we didn't expect. And a lot of people are in pain. And it's turned our organizations into chaos and crisis. The dialogue between people who were friends last week is now different this week, or last month and this month. So a lot of chaos and crisis that has led to social and civil unrest in many of our communities. And so this is hard on all of us. It's hard on all of us. And I want to talk to you a little bit more detail about the unfairness of it all, because it can feel very unfair to have this level of chaos and crisis. And I always use the word unfair because everybody knows what it feels like to be treated unfair. Nobody likes it, okay? It doesn't feel good at all. And we know the impact of unfairness in our lives. But let's talk about what this chaos and crisis has done to all of us right now. Number one, a lot of people have lost their productivity. Even if you were the most productive person pre-COVID, there's something about your life that is not as productive as it is before. Maybe you weren't used to working from home, and now you're working from home with 2 dogs, a 2-year-old and a 4-year-old. And so you can't be productive when you're stuck in a house with 2 dogs, a 2-year-old and a 4-year-old, and you got to work at the same time. Or maybe you don't have little kids, but maybe you're just live by yourself and you're not married and you don't have children. And you're used to socializing and you're used to having stimulation by going to hang out with friends and networking with people. And now you can't do that. And so your walls are closing in on you at home. And so you've lost some productivity. You might even have lost revenue. A lot of organizations have lost revenue. I talked about the businesses closing, but I can tell you at MUSC, where I am and where I've been for the last 6 years, it was significant in terms of the volume decrease that we saw in the early days of COVID. I mean, literally, we went from seeing 5,000 patients a day down to 500 a day. And so that's an impact to your business. It's an impact to your operations. And so many businesses in healthcare, outside of healthcare, have lost revenue or had their revenue streams change because of all of this. And so it has had an unfair impact because people didn't understand how it got this way so bad, so fast. It can really feel unfair. In addition to that, our resources are strained. People are spending more money on PPE than they've ever had. And the term PPE wasn't a part of everyday conversation with anyone before. And now I don't think we'll get it out of our conversation. I see people walking around talking about, are you down with PPP? And I was like, I don't want a PPP loan, but I need some PPE because everybody needs personal protective equipment. You got masks all over your house, even if you're just trying to go to the grocery store or maybe go to the park, or maybe you're still exercising and you're wearing a mask. I mean, these are straining your personal resources, and they're definitely straining our organizational resources. And it can feel unfair in the middle of this crisis. You add on top of that, the economic uncertainty of it all. When is this going to be over? When are we going to get back to normal? Is there ever going to be such a thing called normal? We don't know. We're all worried about it, and it feels completely unfair. And that's inside the healthcare industry. And when we dive a little bit deeper into healthcare, we feel so strained, and it feels like it's completely unfair that we don't have the ability to meet the needs of the patients that we want to serve. That if you want to service rural communities and they don't have access, you don't have the ability to meet the needs. It's difficult. On top of that, You talk about rural communities. I said this earlier. There's limited healthcare access out the gate, but it's even more limited because of COVID, because of what's going on. And so many of our rural communities are isolated and feeling left on their own. Very difficult times, and it can feel completely unfair. We also see worsening health outcomes. Now, I don't have to be coy about this. The disparity between race around COVID positive infections and the death rate and the hospitalization rate and the people who don't make it off of a ventilator is significant. And it is worsening when people don't have access, when people are losing their insurance because they lost their job. These things can feel unfair to those of us who work in the healthcare system. It is difficult to see these worsening health outcomes. Again, we see the widening racial disparities that are popping up every single day. And so it makes it difficult for us to really feel like that we can keep moving forward in this environment. And so when you personalize what this unfair impact of the chaos and crisis has on each and every one of you, here's some simple thoughts for you. I know this is what you might be feeling. You might be like me and feeling some anger. Anger that we didn't solve the problem of disparities sooner, and that it took a global pandemic and a racial crisis for us to focus on racial disparities in America. Stuff that we've known for 20, 30, 40, 50, 60, 100, 200 years as being real, and that we didn't do a whole lot about, that we're now having to be forced into it. And it has cost many people their lives for us to get to this point. And so you can feel angry. You can also feel stressed about it all. Maybe you're overwhelmed just trying to do all that you can, and you can't do all that you want to do. And the stress level is high. Maybe the stress level is high because you're sitting at home trying to figure all of this out, and you're working remotely and you can't do the things that you've always done. Or maybe you're in person, but it's still not the same, and you just feel like you're struggling to manage. Maybe you feel isolated. I talked about this a second ago. There's a lot of people who are feeling isolated. And think about your patients. Think about the people that you serve, how they might be feeling isolated, and how they might already have a health condition, and the last thing they need to exacerbate their health condition is high stress or isolation, where they can't be around other people. These things are difficult. And then this is the last one that I'll point out is the word burnout. This is a word that we don't like to talk about a lot in healthcare, but it's impacting a lot of people. It really is impacting a lot of people. So my question to you, who is feeling burnt out? And I know you may not be bold enough or brave enough to put it into the chat to say that anger, stress, or isolation, or even burnout is impacting you, but I know it is. I know it's real. I talk to enough people in healthcare every day that I know that it's real. So burnout is real. Anthony, I hear you being there. I really do hear you being there. And we're going to try to give you a framework of how you get through that today. Sylvia, it is present. We're going to get through it today. Okay. So let me talk a little bit more about the long-term impact of what is going on right now in terms of this chaos and crisis. This is changing our businesses. It's changing our social norms. How many of you are like me that you'll probably never shake hands with anybody again? I'm paranoid right now. I'm a social guy. I like shaking hands, like meeting people and greeting people, but I'm not shaking hands anymore. I'm doing the elbow bump. I'm doing the fist bump. I'm doing the kid and play kick step with people because I'm just not going to shake hands anymore. I'm not. So it's changing my norm. It's changing our policies and practices. You know, I don't know a restaurant or a business that doesn't require you to wear a mask when you walk in the door now. Now, we know that everybody doesn't wear their mask the right way. Some of them got half off of their nose and on their mouth or on their chin, like a chin strap when they're playing football. But it's changing our whole policies and our practices. It's also changing our economy. Like, some jobs are not coming back, y'all. Some jobs are going to grow rapidly. And I believe that telehealth is going to be one of those places we're going to see massive growth. But it's going to be up to this group to determine how much it grows. So our economy is changing. And yes, finally, our way of life is changing. And I see this as the long-term impact of the current chaos and crisis that we're in. So the question is, in the midst of this long-term impact, I'm going to put this quote on the screen and I'm going to ask you, do you know who said this quote the first time? The quote is, never waste a good crisis. I'm going to quiz some people to see who can answer who said that quote. Who is the originator of this quote, never waste a good crisis? Put it in the chats. Let me see if anybody. Yolanda, do you know? Anthony, Bob, anybody you know? Anybody? No guesses? All right, well, let me tell you who it is. It's Winston Churchill. Now, let me give you the context of this quote and Winston Churchill saying it. He was the leader of Great Britain during World War II. Now, we all know World War II was the second great war. It was a war that was never supposed to happen, but it did. It was the second great war. And that war was devastating to Europe. You want to talk about chaos? You want to talk about crisis? Europe was devastated. It was literally blown apart in France and so many other countries were just physically devastated by the war in terms of death and dying. But here's what happened in the midst of that crisis. Winston Churchill and other European leaders, as soon as the war was over, took the opportunity of that crisis to rebuild their country. And when I say rebuild their country, the reason why Great Britain has national health care, where every person has health insurance coverage and can get access to coverage at a doctor and not have to worry about what it costs, is because they rebuilt their healthcare system in the middle of that crisis. So as we sit in the middle of all of this chaos and crisis, I want your mindset to be focused on not wasting this crisis. Don't wallow in the misery. Don't wallow in the sorrow of things not being the way that you want them to be right now. Don't get down. There's no need to have a pity party. You cannot waste this crisis. And the measure of great leadership is to never waste a good crisis. So I want you to get that in your mind, and this presentation is around helping you to not waste a crisis. So using on the word build, the way Winston Churchill rebuilt Great Britain after World War II, you can't rebuild without steel. You need a lot of steel to rebuild. And so this presentation is called Like Steel in the Hour of Chaos, the power of telehealth and leadership in the age of pandemics and social unrest. Now, steel is the operative word here today. It's an acronym, STEEL. If you're taking notes, this is where you want to start. Like steel in the hour of chaos, because we're in the hour of chaos. We're in the middle of a crisis, and I don't want you to waste it. I want you to take advantage of it. So let's jump right into it. The first thing I want to tell you is I want you to lean in during these tough times. We cannot afford to have you quit. Telehealth leaders and the work that you do is more important now than it ever has been at any point in time. Now, it might have been important before as we build a network to provide care to people in isolated places and get them to be able to get to, world-class physicians and services in an instantaneous time because we can utilize technology. It's always been important. But right now, at this moment in time, on this day, on October the 16th at 9:04 in the morning, telehealth is the most important thing in our state. And so for all of you who do this every day, who aspire to make a difference, to meet people where they are to deliver these services, you cannot walk away from these tough times. I don't care if you are burnt out. I don't care if you are angry. I don't care if you are stressed. I don't care if you do feel isolated or exhausted. You got to lean in during these tough times. That's the requirement of you as a leader right now. You got to lean in. Now, when I say lean in, the first thing you got to do is you got to stay informed. See, leaning in is about knowing what's going on. Or like I said, when I played college football at the University of South Carolina, our coaches used to talk to us about keeping your head on a swivel. You don't want to get hit from the blind side. So you got to keep your head on a swivel, and you got to know what's coming from left to right. So the S in STEAL is either stay informed or what I call situational awareness. This is the first premise that we're going to cover today, is situational awareness. You all, as leaders, got to be fully aware of what's going on around you. So in order to do that, you got to keep your mindset in the game. Your mindset matters. Matter of fact, your mindset is more important than your skill set. That you might be incredibly talented, but if you don't have the right mindset, your skill set won't matter. So what is this mindset that I'm talking about? Your mindset is that we're going to overcome this crisis. Your mindset is that we're going to do our part to make sure that everyone in the state of South Carolina, all 4.5 million people, particularly people in rural counties along I-95 or along I-20 or up 26 or wherever they may live, off 378, off Highway 25 or 527 or 521. It doesn't matter what highway they're off of. I have the mindset that we're going to make sure that people who live off of these roads will be able to access healthcare and the best clinicians that we have to offer in the state of South Carolina, or maybe even in the country, because of my work, because of what I do. That's the mindset that you got to have, that you are a full contributor and a participant to make it a reality for every person that you serve. That's your mindset. The second context is that in order to keep that mindset and stay situationally aware, you got to listen, you got to learn, you got to understand, and you got to ask questions. See, the right mindset is to know that you don't have all of the answers to everything. You don't understand all of the difficulties of everything that I put on. You don't know what the economy is doing, at least not all of the economy. So you got to have a mindset of listening and learning and understanding. If you don't fully understand how disparities are showing up in our society, you got to listen and learn, understand, and ask questions about where those disparities exist, where those inequities exist. You got to arm yourself with information. That's what situational awareness is about. Next, I want you to do it in the right way. And that is, when you're facing a crisis or chaos, I don't want you to react to it. I want you to respond to it. See, reactions are emotional. They're immediate. They're instantaneous. They're literally without thought. They're like a reflex, if you will. But when you get hit with a crisis, you have to respond rather than react. A response is deliberate, it's thoughtful, it's intentional. And so I need all of us who work in healthcare, who are part of the global opportunity to make telehealth a reality for every person, is we got to be thoughtful in our response to what needs to be done. We got to be thoughtful in our conversation, thoughtful in our communication. We got to be thoughtful about all of the things that we do. That's how you respond rather than react. And the last bullet is when you want to be successful, you got to execute. There's no point of keeping your mind together, asking questions and getting information, thinking that you want to respond and not taking action. See, success begins with execution, which means you got to take action. That means you got to do something. Now, I know this is not a political framework, but I'm hoping everybody here has talked to their legislator or the candidates running for legislature and asked them, where do they stand on providing broadband access to every person in every county of South Carolina? I hope you know. I hope you've gotten your answer from them and therefore will make your voting decision in 2 weeks on the elected leaders who will help you to do what you are mission driven to do, which is to help provide telehealth access to people all across this state and across the country? I hope you know the answer to that. I hope you're situationally aware about the people. And if you haven't, then I want you to execute in the next 2 weeks. Send them an email, call them on the phone, and ask them where do they stand on delivering broadband access so we can deliver telehealth services. You should know that. That's just one way to execute, but there's so much more you need to execute on. So I hope we're all clear about that. And my man Rick Foster is on here. Great to see him. So let's get to number 2. You got to be transparent with your teams. Now, when I say transparent with your teams, I want you to know one thing, that transparency breeds confidence. So none of us work alone. We all work on a team. We all work in partnership with somebody. So the question is, when people are confused and concerned about this chaos and crisis, what kind of transparency are you bringing to the table? Are you honest with people about what we can do, what we can't do, what we should be doing? See, transparency breeds confidence in how we're going to overcome the chaos and crisis. The first part of transparency means that your job is to minimize the fear of the unknown. Like a lot of us don't know heads or tails from right now. We don't know today from tomorrow. But you all have some insight around what we can do, what we should be doing. So your job is to minimize the fear of the unknown. You got to get people to a place of comfort that, you know what? Yeah, we don't have all of the answers, but there's nothing to be afraid of. We're going to get through this crisis the same way we got through Hugo, the same way we got through Hurricane Maria, the same way we got through every other challenge that we get through as a state. We have to minimize the fear of the unknown. The second part of that is turning naysayers into believers. Now, I'll put it to you this way. There are some people who work in healthcare who don't believe telehealth is an effective way to deliver care. There's some people who believe that telehealth is not a good solution and that you can't really solve the challenges of disparities and inequity in isolated rural communities with telehealth. But everybody in this group needs to turn those naysayers into believers. Now, how do you turn a naysayer into a believer? You got to show them how we get it done. At MUSC, the most powerful thing we do is when we bring people in to see our telehealth center, to see them how we connect around the state to other healthcare providers. What we're doing in the school system in Williamsburg County around asthma and reaching children and pediatric patients with services. So you got to turn people into believers. So you know how in school when you had to do an assignment and your teacher says, yeah, it might be right, but if you can't show me your work, you're going to get an F. Now is the time to show the entire state of South Carolina the work that you do, the work that we do to meet the needs of the people in our state using telehealth. Turn those naysayers into believers. You also got to help people to understand that change is good. Now, I might need to convince you all of this, that I didn't want COVID to happen. Nobody did. I definitely didn't want the people, the 3,000 plus people in South Carolina to die because of COVID, or the couple 100,000 people in America to die because of COVID. I mean, that's devastating. But I can acknowledge that COVID has been good for me in a couple ways. Number one, I've been able to spend quality time with my family like I haven't been able to spend in almost 15 years. I've also been able to exercise more at home, and I've lost 40 pounds since last year. And since COVID started, about 25 pounds. So I've improved my personal health. And so we got to help people to understand that change is good. That now everybody has no excuse to be able to do a telehealth appointment. You know, there are doctors who rejected telehealth who are now doing, virtual visits, telephonic visits with their patients. You got to let people know that this is good, that we may never go back. Now, for those of you who have children who should be in school but are at home with you, I know you probably ain't thinking there's nothing good about this because you're trying to be a parent and a professional at the same time, and it's difficult. I understand that. But I just want you to know that snow days and hurricane days are going to disappear forever because there's no reason for us to not have school when we now have the capability to do it all virtually. That's a little side note. But you got to help people to understand that change is good. The last piece of this is to get people focused on the future. Don't keep them focused on where telehealth is right now. Keep people focused on what this will look like 5 years from now, because we made an investment in broadband, because we made an investment in access points, because we made an investment in equipping all of our clinicians and every patient with the tools and the technology to be able to receive healthcare in a virtual environment. You got to cultivate people as future thinkers. That transparency around all of these points will breed confidence in people that we're going to get through this crisis together. It's up to you. So now I'm going to move fast and jump through the double E's, and I'm going to get to the L, and we're going to close out. So number 3 in STEEL is elevating your effort. Now, when I say elevate your effort, I already kind of gave you the mindset around this, but here's what I want you to know, is that you got to do your part to make things better. I know you feel like you're doing your part now, but now it's time to step up. It's time to elevate to a higher level. So here's the example I like to use. I'm a basketball fan, an NBA fan of old. So I really like 90s NBA. Michael Jordan, although I was a Detroit Pistons fan, and I really didn't like Michael Jordan, game recognized game. And I had to respect that when things got difficult, Michael Jordan elevated himself literally and physically above everybody else to help his team to win. I mean, I never forget that game. He was going in to make a layup over the New York Knicks. And Patrick Ewing and Charles Oakley, all of these people jumped in the lane and held their hands up. And literally, it seemed like Michael Jordan elevated even higher above them to make the basket. So my question is, are you elevating your effort to make things better when it comes to delivering telehealth? And this is what I want you to do. I want you to strengthen your knowledge around how do we make broadband fully possible in the state? How do we deliver services everywhere? I know you know some things, but there's a whole lot more we all have to learn. So strengthen your knowledge about all that is going on. Strengthen your knowledge about how we can respond to COVID in a telehealth way. I want you to also to step up and encourage other people to step up. Everybody should be an advocate for telehealth and broadband in our state. Everybody should be. Your spouses should be, your children should be, your partner should be, your neighbors should be. So the question is, how are you communicating with people about why this is so important to do right now? Because we begin to make change when we all step up and we all engage together. So I need you to step up and encourage other people to take action. I need you to strengthen your skill set. Like, if you're not using this time of social distancing, of home work, telework, virtual work, whatever it is you want to call it, if you're not using this time to get better at something, then you're missing the mark. Like right now, you know, I'm taking a course at Johns Hopkins on contact tracing. Now, I don't want to be a contact tracer, but I'm stepping up my skill set to know what I can do to help make sure that if I was to get sick, that I know how to do contact tracing in the right way and help DHEC out, because they're busy and they're stretched. But if I can come to them and say, hey, I tested positive, but I know where I've been the last 2 weeks and who I've been around. Here's their name and phone numbers, and here's all of the information you need. I can help them. So strengthen my skill set will help to make things better for others. So what are you doing? The last point on this is that I want you to learn how to serve people before you try to lead them. See, the greatest amongst us will be our servants. And so Dr. King said, anybody can be great because everyone can serve. So my question to you is, how are you serving people in this time? Yeah, I know your job is to serve and take care of patients and deliver telehealth services and make sure technology is there. But what are you doing to really serve people in this moment? See, if you want to be a leader and you want to have a bigger impact, you got to learn how to serve first and lead second. You got to find a way to serve. That's elevating your effort. Now, the next E is really empowering people. So I always talk about it like this. If service is the prerequisite of leadership, empowerment is the essence of leadership. And that is, we should be equipping people with the tools, the information, and the resources to determine their own destiny. So I want you all to be like steel and empower those around you. And what does that look like? The best leaders know this one. This is a John Maxwell quote here. If you know the way, then show the way. That if you know how to get something done, then show other people how to do it. Don't do it for them all the time. Show them how to do it. This is technically what we do when we empower patients. We know the way and we show them the way. And we all need to be showing each other the way on how to utilize virtual, digital, technologically advanced platforms for health management, health improvement, to increase health outcomes, particularly those who are underserved and struggle in rural communities and maybe have literacy issues. If we know the way, our jobs are to become teachers and show the way. That's empowerment. It also means engaging and elevating new people, new members. And when I say members, I'm talking about members of the association. This alliance that you have, there are a lot of new people who will be joining because telehealth is becoming a part of their life. So what are you doing to engage them more deeply? Elevating them to get them fully invested the way you have been fully invested for 8 years in doing this work. You got to get them invested. So you got to elevate and engage people. You know, next thing I want to talk to you about is training the next generation on policy and practice. And what do I mean by that? Is that this evolution of telehealth is changing lots of policies, legislative policies. There are things that we couldn't do or we had laws against doing because we were used to seeing healthcare in a physical environment. But now we're in a digital environment. So there's a lot of things that need to change, like the reimbursement rate for telehealth. Duh. So what are we doing to advocate to make sure that the payment models fit the delivery models? We got to be a stronger advocate for that. And we can't shy away from it, y'all. We got to be fully invested. We got to have a mindset focused on getting to that level. So we got to train the next generation of policymakers and advocates on policy and practice. We just got to get there. So here's the L in steel. We got to lead through the crisis. And when I say lead, I'm not talking about a generic lead. I'm talking to you. I'm talking to each and every one of you as an individual, that you got to be strong to lead us through this crisis. So leading us through this crisis for you looks like this. Acknowledge the reality of what's going on. Don't pretend to yourself that this is not a big deal, that change is not happening, that the challenges are not before us, the health disparities are not real, that structural racism is not real, racial inequities. Don't pretend to yourself, because if you worked in healthcare longer than a month, you know all of this stuff is real. So stop pretending. See, good leaders don't pretend. They tell the truth. They acknowledge the realities. They're honest about where things are. And they're public about it. Number two, you got to learn how to leverage mindfulness, which is you got to stay present in the moment, which means you can't do this 24 hours a day, 7 days a week. You got to check out. You got to find a hobby, a pastime, something that's going to keep you level-headed in the middle of this crisis. My thing for checking out is taking a long walk first thing in the morning, listening to some classic hip hop. That's what I do. I check out from that. And my artwork on the walls behind me shows you that I know good classic hip hop. So you got to find a way to leverage your mindfulness. That's really important for you to lead through this crisis. The third thing is self-care is important. The flight attendant told us when we boarded planes before COVID that before you try to help somebody put on their mask, you need to put the mask on yourself first, because you're no good to anybody if you pass out from a high altitude of a crisis trying to save somebody else. So save yourself first. Self-care is incredibly important, okay? You gotta have some self-care. You got to, whatever it is, eating different, laughing. I mean, like, I've forgotten how important humor has been in my life. And what do I mean humor? I'm a funny guy generally. I make a lot of jokes, but I really enjoy stand-up comedy. And I really enjoy, going to comedy shows or watching comedians on TV. And guess what? I haven't partaken in a whole lot of that in the middle of this pandemic. So self-care to me now is watching old classic Richard Pryor on Netflix. I didn't even know it was on Netflix. Now it's a little risque and not PC, but he's hilarious. You can't mistake good comedy. So for me, self-care is about catching some comedy and having a good belly laugh. So I don't know what it is for you, but in order to lead through this crisis, you got to take care of yourself. And the last one is I want you to be an inspiration to people around you. You got to inspire your team. You got to inspire the members in this association. You got to inspire your communities, inspire your patients. You got to be inspirational. See, it's dark times right now, and we got leaders who drag us down by their decision-making, by their language, by their thought processes, by what we're dealing with and how they've responded to the crisis. But don't be like them. Be the opposite of them. Lift people up. Inspire them. Let them know that everything is possible, that we can get over this. So you got to be the beacon of light, because light is one that runs the darkness away. Darkness can't put out darkness. Only the light can. So you need to be the light for everybody around you. So you got to learn to lead through this crisis in this way. So as I close, I want you to know, I need you to be like steel. Be steady, be strong, and unbreakable. That's what this is about. We need the telehealth industry in healthcare in our state to be steady, strong, and unbreakable. We need broadband access to be steady, strong, and unbreakable. We need our clinicians to be steady, strong, and unbreakable. We need our support staff to be steady, strong, and unbreakable. And we need our technology to be steady, strong, and unbreakable. If we're going to rebuild and not waste this good crisis, we gotta be like steel. So in summary, lean into these tough times, minimize the fear of the unknown, train the next generation, and yes, take care of yourself. Take care of yourself. And as I close, I want to say thank you. I want to make sure that we stay connected. You can find me on LinkedIn, Facebook, Instagram, Twitter. You can find me online. You can connect with me wherever you need to connect with me. I want us to stay connected, and definitely reach out to me. And if there's anything that I can do to help you all to be better at what you're doing, please ask. It is my intention to serve you first before ever trying to lead you. So with that, I'm going to stop sharing my screen, and we got about a minute, and I want to look at some of the chat function. I got two monitors here. One, I'm doing the presentation here. The other is that I'm seeing the comments here. A lot of thank yous. I'm glad you're not running on empty, Anthony. I really appreciate you all. You all are doing great work, and I'm inspired by you. I want you to continue to be the best that you can be for everyone that you can serve. And if something in this presentation has been important to you, I want you to meditate on it. I want you to write it down, put it on a sticky note, stick it on your mirror, stick it on your desktop. I want you to live it as best you can. That's my prayer for you. So thank you all. Have a fantastic day. Take care.